Hi, folks. Pat Healy here from the Laker News. I'm here with Tracey Barbrick, who is in charge of the vaccine rollout here in Nova Scotia. She calls herself a professional administrator. So we're going to get started with some questions. It seems Fall River has a deep connection to this pandemic with you and Dr. Strang leading the way to keep us safe. That has to be a pretty cool thing, Fall River leading the charge.
I know it's true. Who knows what happens in the Sobeys parking lot, hey?
Yeah. Um, what has the process been like in getting the vaccine rolling out?
Oh, listen, it's been a ride. Our biggest challenge has been supply of vaccine making its way to Nova Scotia from the national supply, and so that has been up, down. Things come sooner or later than we expected. Different amounts come than we expected. So supply has been our biggest challenge for sure.
And today you just dropped the vaccine age to 35.
We did.
So just before we came on the here
And
for
we
the
did.
broadcast, I got the press release for that. So I was like, cool. Now my brother can get it.
Oh, great. Good. Yeah, 35. We're into the young people now. We're not
Yeah.
even, in the early days, it seemed like it was going to be such a long path to get there. And here we are in the 35-year-olds and moving quickly.
I'm sure you've heard all the comments and criticisms online about the vaccine rollout being slow and not good enough, that Nova Scotia is last. To me, it's not really a race to be first. So because like things are complex and building it up. What do you say to
Yeah.
those people with the criticisms?
Yeah, I hear those a lot. So we're not last anymore, just so you know. There's a national dashboard that reports that we're not last anymore. And we took on the front end of all of this, we were very committed to building infrastructure so that we would have a good, reliable, predictable program for Nova Scotians. So we've built this centralized booking system that is really the envy of the country, that every citizen can go to one place and find everything that's available to them and make a decision about what the vaccine they want, because we identify exactly what vaccine is where, and decide how far they're willing to travel or whether they want to wait a little bit longer and get something closer. So a lot of that infrastructure took a little bit of time. We also made the commitment to hold back second doses and make sure that if Pat got his first dose, that he would get his second dose exactly when we said he would. And we were one of the few provinces that did that. So we are now, I agree with you. It's not really a competition. Canada is only safe when the globe is safe. And so we're all provinces, whether you're third or fifth or 10th, we're all within a few days of each other. So the placement looks interesting, but the actual vaccine in the province is, we're all within a couple of days of each other.
How does the AstraZeneca pause affect the vaccine rollout?
Yeah, not a whole lot in timing because we didn't ever expect to have a whole lot of AstraZeneca. We knew we would be primarily working with Pfizer and Moderna because of the supply available, but it certainly affects people individually and their worry, particularly if they, did you get a first dose
Yeah,
of AstraZeneca? Right.
AstraZeneca. So, I mean, I'm okay. I was like going for the first vaccine that was available for my age group.
And
And
that-
I've kind of felt a little not ticked off, but just a little, oh, I should have waited because here 40 for, Pfizer last week and now,
Yeah, it's a good vaccine. It's not that it's not. The reason that we discontinued our program was that people were starting to cancel appointments
yeah.
because of the global discussion. So the providers were running clinics with only a couple of people coming. So it was getting hard to manage for them, as well as the kind of increasing events around that thrombotic event that's very rare but can be very serious. So the reason we discontinued was kind of a combination of those things. But what we're trying to assure people now is it was the right decision to make for yourself. And we'll make sure that we've got you covered for a second dose. So we'll get a little bit more science. And then likely you'll be able to decide, do you want a second dose of AstraZeneca or would you rather take a second dose of either the Pfizer or the Moderna? So as soon as we get the science, which sounds like the 1st of June, before your second dose was probably due anyway,
Yeah.
we'll have a path for you. So we want to reassure people they don't need to worry. we've got you covered. We'll make sure we get a second dose of the right thing for you.
All right. Is it true you don't ride your bike anymore since you fell in love with Roger? You can guess who said that. Who asked me to say that?
Rob, probably.
No, Eric McIntyre.
No, Eric. Yes, Eric is a big cyclist, and we were cycling, not me cycling with him because he's way too fast. I couldn't keep up. But he was certainly my guy that I bought bikes from, and he taught me about bikes. And then I got big Roger, who's up to my waist, and Roger doesn't bike. So I do a lot more walking and, trips to the woods. But yes, I would like to get back to my bike soon.
I think we all would like to try and get back to some normalcy soon.
Oh, soon, not soon enough.
Yeah, these Zoom interviews are okay, but I'm an in-person interview person, so it's tough.
Yeah, it's true.
How have you dealt with the ever-changing vaccine deliveries and changes? It must make for a lot of unknowns with the changes from NACC and delays in dosage here at the start.
I really appreciate that question, Pat. It is like planning with a blindfold on and one arm tied behind your back. It's there are the amount of variables in this rollout are more than you could ever expect. The vaccines all need to be stored at different temperatures. They all have different handling requirements. They come on a different schedule when they come into the province. They're targeted at different people for various reasons, and then the supply goes up and down. But we have an incredible team of very committed, we're, thousands of people now involved in this, and they are just knocking out of the park every day. We exceeded 400,000 doses in arms the day before yesterday. We've got almost 40% of Nova Scotians with at least one dose of vaccine in their arms. And we see the path where if the supply keeps up, potentially by the end of June, everybody will have a single dose, and then we'll be hot on the heels of second doses.
Yeah, like there's light at the end of the tunnel.
There's light at the end of the tunnel. I agree. Paul.
I don't know if you can answer this question or not, but many would like an answer to. I have it on my list for Dr. Lisa as well. What do you know at this point about how effective the vaccines are in fighting all the new variants?
Yeah, so far, all of these variants are emerging and the clinical trials are happening in real time. So as we've evolved into all of these, the variants so far, is the vaccines are showing to be quite effective at both preventing serious illness and death, as well as reducing transmission between people. So the signs are good that they are all staying close enough in similarity that the vaccines are still effective. So they'll keep monitoring that as the cases keep moving around the globe.
14 months ago or so, you and your team were like relatively unknown. How's it feel to play such an important role in this pandemic with the province, and why?
Oh, an amazing privilege. We really have the best of the best working on this, and the health authority team and the Department of Health team and the physicians involved and the pharmacists involved and all of their associations are just, everybody is top-notch talent and so committed, because it's the end of, it's the light at the end of the tunnel for all of us. So yes, relatively unknown, and then find yourself on the news regularly is very interesting, and my father's very proud.
Next question is probably a good one with everything with mental health and everything. How are you doing mentally and emotionally, you and your team? This has to have been exhausting for you and those helping with the vaccine rollout.
That is a very kind question. We're all pretty burnt out. I won't lie. The whole healthcare system is pretty burnt out. But everybody, I think, is digging deep with this view to putting this in our rear view mirror. I try to get out with my big dog Roger as much as I can. I try to spend some time with my wife and our two kids that are 12 and 18, and try to recharge where you can, even if it's small amounts of time. And I know our team is all doing the same, but there's no illusion. Everybody is working really hard and a lot. So they're all going to need to recover when we get to the fall and get this done.
Anything else you'd like to add to Nova Scotians?
No, I'd like to build their confidence that we got this. We got the province on this. We want it to be reliable and an experience that has everybody not feeling anxious, but get their appointment booked, get in, feel confident about the vaccine, know that we've got your back on second doses, and we just want people to feel confident that we're going to get this done.
Thank you. Have
Talk to you
yourself a
soon.
great day.
You too, Pat.
Bye.